Hello, my name is Dr. Brian McClelland. I am author of Marketing Dentistry Kaizen Style, Small Steps to Big Profits. It can be found at www.dental-marketing.org or at amazon.com. Today I'd like to go over an article from the Journal of Oral and Maxillofacial Surgery. It is in the section on dental alveolar surgery, and it's in regards to predicting the incidence of permanent numbness, or at least the risk stratification of permanent numbness with the extraction of mandibular third molars. The title of the article is Darkening of Third Molar Roots, a Panoramic Radiographic Association with the Inferior Alveolar Nerve Exposure. The authors of the article are Joseph Cezalma and Edna et al. It can be found in the Journal of Oral and Maxillofacial Surgery, page 1544 to 1549. In this study, the authors broke the patients into two categories. There is the control and the test group. And the test, or the hypothesis that they are testing, is whether or not the darkening of the roots leads to an increased risk of exposure during third molar surgery. So what they did is they took a total of 116 patients which had darkening of third molar roots on the panoramic radiograph, and then they had a control group. And in their control group, they were still at high risk of exposure since they had other radiographic findings that placed them in the high-risk categories, which included interruption of the white line on the panoramic radiograph, diversion of the canal, and narrowing of the canal. The control group was then subdivided into two additional groups, or into two groups. One of those groups had one of those high-risk signs, and one of the groups had more than one of those high-risk signs, but neither of the control groups had darkening of the root. So let's get into the results. The average age, the mean age of patients were 26.7 with a range of 21 to 59 years of age. What this alone tells you is that patients that are over the age of 21 and statistically over the age of 25 have an increased incidence of permanent paresthesia with the extraction of mandibular third molars. So there was a total of 309 extractions. The inferior alveolar nerve was visible in 47 cases. 27.6% of those had isolated darkening of the root, and 7.8% were in the control group. So they had other radiographic signs, but not the darkening of the root. Of the 47 patients with the inferior alveolar nerve visible, reversible paresthesia occurred in 8.5%, or 4. And you'll note that was reversible paresthesia. There was, this is a statistically significant increase. The risk of inferior alveolar exposure was significantly greater in group 2, which had multiple signs plus darkening, than in group 1, which only had darkening. The risk of inferior alveolar nerve exposure was significantly greater in group 2 than in group 4, so those with the multiple signs plus darkening than those with multiple signs with but no darkening. So perhaps the most accepted agreement through all of the studies, including this one, is that the absence of these specific signs on a panoramic or radiographic evaluation provides the most reliable information and states that the patient is likely at lower risk of having a permanent paresthesia with extraction of their third molars. In this study, they looked at direct visualization of the inferior alveolar nerve, and presumably with increased risk of visualization also comes an increased risk of permanent paresthesia. In the present study, the incidence of visualization was 15.3% overall. I also found an interesting pearl in here, just noting a anatomical dissection of the neurovascular bundle, stating that the vein laid on top of the nerve and was in the 12 o'clock position in the neurovascular bundle. The suggestion here is that if you're doing surgery and there's no brisk bleeding, the vein has not been encountered, and you have less of a chance of a permanent paresthesia. So, several investigators have previously demonstrated that the simultaneous presence of two or more signs on the panoramic radiograph results in an increased risk of inferior alveolar nerve exposure.
Darkening of the third molar roots together with adjacent high-risk signs results in the greatest risk of nerve exposure, which is significantly more than darkening of the root alone when there are no other signs present. So in conclusion, the authors suggest that cases of root darkening and one or more adjacent high-risk panoramic signs, which include interruption of the superior cortical canal, narrowing, and diversion of the canal, simultaneously presented on the radiograph on the Panorex, have the greatest risk of exposure and presumptively the greatest risk of paresthesia. Well, that's it for today, and thank you for tuning in for this week's article review. Please feel free to go to www.dentalmarketing.org for many other presentations and article presentations that occur weekly and can be found. If you have any questions, please feel free to contact me or email me at info@dental-marketing.org. Thank you.